Good afternoon and welcome. It's Friday, February 3rd, 2023, and the Protect Our Province briefing today is on COVID Reality Check with Dr. Sanjiv Gandhi. My name is Dr. Susan Coe, and I'm a family physician and member of Protect Our Province BC. Protect Our Province BC is a grassroots organization of physicians, nurses, scientists, health policy specialists, and community activists. We are working together to keep British Columbians safe by sharing accurate information about the COVID-19 pandemic. We're asking for a science-based approach to be used in the management of the pandemic in BC. Before proceeding with this interview, we'd like to acknowledge that we are broadcasting from the ancestral, traditional, and unceded territories of the Coast Salish, Musqueam, and Tsleil-Waututh nations. We are honored today to have with us Dr. Sanjiv Gandhi. He is a clinical professor of surgery at UBC and former chief of cardiothoracic surgery at BC Children's Hospital, and now one of the deputy leaders of the Green Party of BC. Dr. Gandhi, all of us at Protect Our Province BC have been so inspired by your courage in speaking out about the crisis at BC Children's Hospital with the pandemic of COVID, influenza, and RSV. So thank you for joining us today.
Oh, thank you, Susan. It's a pleasure to be here.
So Dr. Gandhi, with year 4 of the pandemic upon us, and with more infectious and transmissible COVID variants arising, where do you think we stand right now with respect to the pandemic?
Well, Susan, scientifically, objectively, we're really still in the midst of this pandemic. Emotionally, much of the population, I think to no fault of their own, is in a different place. Some would say that we have to move past COVID and learn to live with it. But I think this thinking really demonstrates a fundamental ignorance and lack of education. And that's unfortunately an approach which has been encouraged by a government that hasn't been honest with British Columbians about the virus, how it spreads, and how to protect ourselves. Polls, for what they're worth, but I'm sort of in the polling business now, suggest that voters don't particularly care about COVID anymore, but it really needs to be science, not polls, that guide public health. The COVID-related death toll continues to increase. More people in BC and in Canada died from acute COVID in 2022 than in the preceding 2 years. And those numbers don't include people who suffered other medical issues because of previous COVID infections. The potential ramifications of repeated COVID infections for everyone, all individuals, young, old, those with pre-existing medical conditions, and those that were previously healthy, are significant. Most people recover from acute phase illness, but the numbers still getting sick are significant, and that sickness can last for a long time and manifest in different ways. So unfortunately, though we want to be done with it, I want to be done with it as much as anybody, it's not done with us.
Well said. Now, in BC, healthcare workers have been restricted in discussing anything to do with the COVID pandemic with the media. So what led you to speak out?
Well, for me, it's the case for far more than just COVID. I've been, and healthcare practitioners have been silenced on all sorts of issues for years. I started to speak out on healthcare issues as a result of what I've experienced firsthand in our healthcare system for far too long. Administrators putting optics ahead of truth and self-interest ahead of patients. And I finally recognized that by staying silent, I was an accomplice after the fact. I think there are very few hills to die on in life, but for me, this was one of them. And I left my employment because I couldn't stand idly by. And I realized that the only way to fix problems in the system was to step outside of it and use my experience that I've gained over the last 3 decades and knowledge to help reshape it.
Thank you for sharing that with us. Many of us use this wonderful quote from you: to institute a simple, harmless, effective measure that's temporary to help our kids, at least in the short term, is incomprehensible to me. Government and public health apathy in the face of dying children makes no sense. Were you referring to masks as the effective measure? And what is the BC Green Party's position on mask mandates?
Yeah, I was talking about masks. There's lots of measures, but that quote referred to masks. And masks have become, unfortunately, a political issue, an emotional issue, and a cultural stigma almost. But masks are just another form of preventative medicine. Preventative means not getting the disease in the first place. Wear a mask before you get sick, not afterwards. The concept of putting a mask on after you feel ill makes no sense to me. It's like putting your seatbelt on after the car's already crashed. I mean, similar to the airborne nature of COVID and why masks are effective, if you think about, I don't know, somebody spraying a can of mace in a room, it doesn't leave immediately. Like you can walk into that room a few minutes later and your eyes are going to burn and your lungs are going to sting. And COVID's just like mace. As far as the Green Party's position on mask mandates, I mean, it really should be the common sense position. Follow the science, adapt to the situation. This past winter, we needed a mask mandate in closed indoor spaces and public transit and schools. And I think the thinking is going to evolve based on the respiratory pathogens circulating, the chaos they cause, and other factors like our ability or inability or lack of will to control and improve air quality.
Well said again. Against the current scientific evidence, BC Provincial Health continues to recommend the use of droplet precautions for an airborne virus, and nursing staff are still restricted from using N95 masks except for aerosol generating medical procedures. What is the Green Party's position on the BC droplet dogma policy and the restrictive use of N95 masks?
Well, I mean, COVID, like many other viruses, is an airborne disease, full stop. The fact is not up for debate. The inability of government to state that categorically is, I think, politically based. Acknowledgement of that fact would make them culpable for their inaction on measures which would then be seen as mandatory to mitigate spread, like improving air quality.
So, Dr. Gandhi, during this pandemic, parents have been frustrated by the lack of action of school boards and health authorities to make our schools COVID safe. Only some schools have upgraded with MER 13 filters, and a very few classrooms have had HEPA filters installed. What would the Green Party do to make schools COVID safe in BC?
Well, again, I mean, to control viruses transmitted via airborne mechanisms, and let me be clear, I think it's a fallacy to think COVID is the last of these. It will not be the last of these. We need to manage that transmission with proper interventions. We stop waterborne diseases with clean water. So stop airborne diseases with clean air. It's not just about COVID. It's about the nature of airborne diseases and what we've learned because of this pandemic. And we know how to measure air quality. We know how to fix it. So it's easy. CO2 monitors in every classroom. Air filtration devices should be in every classroom. It's not that difficult. What's been lacking is the political will to do this. And I've discussed this with several school board officials and education administrators, and really it's not their fault. The problem lies at the level of BC Public Health and the Ministry of Health, from whom these schools take their guidance which has not been complete over the past few years.
Thank you for that answer. During this pandemic, racialized and socioeconomically deprived populations have been adversely affected by the pandemic with more hospitalizations than deaths. This is seen very clearly in a recent StatsCan report in 2022. What will the BC Green Party do to help these groups?
Well, I mean, the health outcomes from COVID in racialized, minoritized communities reflect the same poor health outcomes that these communities experience with a whole host of other diseases. And the root of these problems is really intimately attached to so many of the other issues that society in general, and certainly the Green Party, cares about: affordable housing, financial stability, clean environment. And without properly addressing these issues, the healthcare outcomes aren't going to change. And the BC Greens, for one, believe strongly that government needs to provide these basic services, and that communities with disproportionate outcomes need specific individualized support. The government should be actively listening to these communities and building plans tailored to their unique needs.
Well said. Many public health leaders are blaming the early pandemic measures limiting exposure to COVID for causing so-called immunity debt, for why so many children were sick this fall. What do you think about the theory of immunity debt?
You're trying to get me riled up, aren't you? The I mean, the whole concept of immunity debt and hybrid immunity, they've largely been debunked. Never, ever have we promoted illness to promote wellness. We don't make people sick to make them better. And that thinking demonstrates a complete ignorance for the ramifications of the SARS-CoV-2 virus. It doesn't recognize the vascular nature of this virus and falsely concentrates on the acute respiratory symptoms. So let me state it clearly. COVID is a vascular virus. The receptors exist on every organ in the human body, and that means COVID is about so much more than acute disease. It's more than the sniffles and a cold and a fever for a few days. This virus can hurt your heart, your brain, your gut, your immune system. It can cause blood clots, issues with pregnancy. You get the point. The list goes on. And the scientific evidence for this is accumulating at a staggering rate.
Mm-hmm. Yeah, I totally agree. During this pandemic, BC has restricted access to PCR testing, rapid antigen tests, and effective treatments for COVID, such as Paxlovid. And as you know, Protect Our Province BC is advocating for increased access to Paxlovid in BC, which has one of the most restrictive uses of Paxlovid in our country. What is the Green Party's position on Paxlovid?
Yeah, another mind-boggling situation. I mean, a fundamental tenet of healthcare, having been a doctor for 30 years, is accurate diagnosis guides effective treatment. Like that's part one, right? When somebody comes into your office, you got to know what they have. And the proclamation that knowing which virus is causing symptoms is irrelevant is just wrong. I mean, that's the party line, but it's just wrong. Different viruses have short-term and long-term implications, and targeted therapies like Paxlovid for COVID or Tamiflu for influenza make a difference. There's no reason to restrict the use of Paxlovid for those that are eligible and in whom the drug may confer benefit. The excuse about there's a lot of drug-drug interactions with COVID, with the Paxlovid, and it's difficult to prescribe. Well, drug-drug interactions are present with many drugs, and they can be sorted out with good doctors and good pharmacies. With regard to cost, which I think might be the reason for the restrictive policy in British Columbia, though I can't verify that. I mean, the cost of Paxlovid doesn't compare to the cost of admitting people to hospital because they couldn't get appropriate treatment, potentially including Paxlovid in the first place. The best way to reduce cost in healthcare is to keep people healthy. So, as you know, and inferred by your question, the restrictive nature of Paxlovid in British Columbia far exceeds that of any other jurisdiction in Canada. And I'm not sure why we think we're so different.
Totally agree with your statement. Thank you very much. This leads to our next question. So, in a recent article in Nature by Dr. Hannah Davis and Eric Topol, it details extensively the serious effects of long COVID. Yet, in British Columbia, many of our healthcare professionals still refuse to acknowledge the existence of long COVID. What will the BC Party do to help patients with long COVID, which is increasing in numbers every day?
Yeah, it's getting significant, very significant. Well, I mean, I think we need specific clinics with experts knowledgeable about this disease that are present for other diseases. It's imperative. We have these clinics for disorders whose prevalence is far lower than long COVID. So the same thing is going to need to happen with this evolving pathology.
Well said. And Dr. Gandhi, what do you think were the biggest mistakes in the pandemic management in BC so far?
I thought this webinar was only an hour. Where do I begin? Well, I mean, to sum it up, I mean, there have been many errors related to the specifics of the pandemic response. But really, I think you can trace them all back to a failure to adapt to a changing science, which should have been used to educate the public properly and institute proper public health and individual protective measures.
Okay, so then you'll like this question as well then. Dr. Gandhi, if the Green Party came to power, what would be the top 3 things it would do to change or start doing to manage the COVID-19 pandemic in BC?
Well, that's an easier question than the last one. Number one, I'd say proper education, rooted in science, geared to empowering people to make informed decisions. Right now, we tell people to assess their own risk, but we don't tell them how to do it, and we don't tell them what that risk actually means. Number two, clean air. We still don't have appropriate clean air strategies. And this is fundamental to getting out of this mess and being prepared for the next airborne virus. Mm-hmm. And number three would be, where appropriate, remove the barriers for testing, remove the barriers for personal protection, remove the barriers for treatment.
Well said, and I totally agree. Is there anything we haven't covered that you'd like to add?
I think that was a pretty exhaustive list of questions that cover most of the issues. In talking to friends, family, people that I associate with, again, I really think that most people want to do the right thing. Most people want to protect themselves and their loved ones. But we've gotten into this place of having to learn to live with it without adequate education of the public with regards to what learning to live with it really means. So much of the discourse about COVID these days is about spewing out numbers about hospitalizations related to acute illness, and that just fails to tell the real story. COVID is not about the acute illness anymore. It's about what happens down the road. It's like when people come to your office, Susan, and talk about smoking cessation. Like, you're not going to die tomorrow or get lung cancer tomorrow if you smoke a pack of cigarettes today. But if you repeat that behavior over and over again over a prolonged period of time, your risk of lung cancer goes way up, right? Like, it's not that difficult. And the same thing with COVID. If you keep getting COVID infections over and over, we know that the chances of that hurting you in the longer term are significant. And I really think that most people just don't know that. And again, it's not, there's nothing malicious about them not knowing it. It's just that we haven't educated them. We haven't told them what this disease is about. We started it off with COVID restrictions and put it in a bad light. I mean, these restrictions should have never been framed as such. We should have called it COVID protections. And in the whole philosophy of dealing with this public health crisis has led us to this situation right now where people like you and me are accused of being obsessed with COVID. And I'm not obsessed with COVID. What I am obsessed with is caring about the health of people. That's what I was in the business of for 3 decades. And caring about the health of children specifically. And if we don't all care about that, well, what's the point? So I really think that we've done a disservice to people by not informing them about what a mess this has become and what it potentially means for the future.
Thank you very much, Dr. Gandhi. That was very well said. Now we're going to move on to questions and answers from the media and Twitter. But first, one of our Protect Our Province BC members has a question. I have a public-facing job. My coworkers and I have raised COVID safety concerns, but with weak guidance from BC Provincial Health, it's easy for our employer to dismiss what we say. Thoughts on what we can do? Some of us have faced intimidation for raising the concerns, and we are prohibited action compare. We still don't know if we'll be even approved for review. And they're asking about any thoughts about what we can do.
Yeah, you cut out a little bit there, Susan, but I think I got the gist of the question. um, I get it. I mean, um, I I get it from personal experience, and I get it from the people that I've talked to specifically in the education system. And when public health and provincial health and the Ministry of Health is telling you that this is what you should do and this is good enough, um, it's very difficult. It puts people in extremely difficult situations when they want to do better, when they want to do what's right, when they want to advocate for clean air and HEPA filters and masking when current. And I think you have to lead by example. Um, you know, I've been in many situations where I'm the only guy with a mask in the room or a mask in a specific place. And if you feel like the air quality as you measure it is not up to snuff where you're at, I mean, buy a HEPA filter and put it in, or like, I think you just have to take it upon yourselves to do the best you can, and lead by example. And as far as employers go, like trying to convince them that in the long term, this is going to help their business, their employees, the health of everybody, and it makes sense both from a health perspective and a financial perspective, is sort of the best that we can do when we're fighting a little bit against the messaging that we get that's not complete from public health.
Thank you. Our next question: how do we stop the hemorrhage of healthcare workers in BC to meet both the current and future healthcare demands?
Oh my. Well, that's another long one. The healthcare system in British Columbia has a lot of improvements to be made. And what I've seen over the past number of years is band-aids on bullet holes. And we don't need band-aids on bullet holes. We need major surgery to reinvent the healthcare system in British Columbia. It frustrates me to no end because it's not about just pouring more money in. It's about efficiency of healthcare delivery. It's about respect to those people in the system that aren't listened to. And without a major overhaul of that, it's going to be difficult to prevent people like me from leaving the system. I mean, I absolutely loved what I did for a living. It was, I tell people, it was the best job on the planet, bar none. But the toxicity of the workplace and the politics involved even drive a heart surgeon to decide that it's time to move on and contribute in other ways. So, Sonia Firstino and I had a press conference yesterday. There were some audio difficulties, but we had a press conference about community health centers and how primary care needs to be delivered in a different fashion in British Columbia. And we need to measure how healthcare is delivered. This new physician's master agreement is a good first step, but it doesn't really have any accountability metrics in there so that a few years down the line, we know whether the PMA or the new PMA, renegotiated PMA, has actually helped solve the problem it was designed to do, which is that 1 in 5 British Columbians doesn't have access to a primary care doctor. So we need to reinvent the way healthcare is delivered in British Columbia, and we need to really respect the people in the system, the nurses, the doctors, the ancillary healthcare providers, and listen to them. And we haven't been listening to them. Policy has been dictated by administrators and government officials in a silo that don't take care of patients. We do. We know what the problems are. We know how to fix them.
Thank you very much. Our next question: these infections are creating lasting health problems, further burdening the healthcare system and creating a higher percentage of disabled workers. How does the government think this is going to help support our economy and the available labor force?
Well, you're preaching to the choir, Jessica. Yes, they are further burdening the healthcare system, and and workers, individuals in general, are sicker. I mean, the whole concept of we need children to go back to school, so it doesn't matter if they just tested positive for COVID, they can still go back to school, is ridiculous, right? I mean, schools were empty this winter. I mean, the vacancy rates were between 25 and 75%, depending on the school, because children were sick. So I can do nothing more than agree with you on that question and answer it only in the sense that the main motivation of the government has been to preserve a narrative. And the narrative has overtaken the well being of people as the most important thing. There's nothing to see here. Everything's okay. All the decisions we made were correct. Seems to be the most important thing at the end of the day. So the question's a good one. I wish I had a more articulate answer.
Thank you very much. We're just waiting for some next questions to pop up. Yeah, just going to ask our producer any more questions. Here we go. Nearly half of all COVID-19 related WorkSafe claims were healthcare workers. What do you think that says about the impact of the pandemic on those workers?
Well, it says exactly what I've been saying. The pandemic's not over. Healthcare workers, I mean, it's been well advertised how many doctors and nurses have been sick, and the pandemic is directly to blame in the sense that it started this whole thing. It's indirectly to blame in the sense that because of the immune damage caused by COVID, these healthcare workers, as many other individuals of the population, have become more susceptible to other diseases. So, I mean, part of the staffing problem at BC Children's that led to all the canceled operations this year was not just nurses and doctors sick from COVID. It was nurses and doctors sick from COVID and other respiratory pathogens that they now were more susceptible to because of the immune damage from COVID. So again, that's something that we haven't paid enough attention to. When I say we, public health hasn't paid enough attention to, and it causes a downstream effect that affects everybody. So yeah, I mean, it's healthcare workers are human beings too, and they're going to get affected just like everybody else, and perhaps more so because they're around sick people every day.
Yes, it's very interesting, WorkSafe stats, because if you take a look, it looks like more long-term care workers were affected than acute care workers in the healthcare stats. What do you think your thoughts about that difference in number?
Yeah, I haven't seen those numbers, so it'd be difficult for me to comment without actually looking at them. But I mean, it may have something to do with the frequency of people infected at long-term care homes. I don't really know. I have to delve into the details a bit more before I could make a educated comment on that.
Good. So we're just waiting for more questions to be put up on the screen. So, but thank you very much for coming to the interview with us today. Oh, here we go. We have a live question. But thank you very much for coming to the interview with us today. Oh, here we go. We have a live question. But thank you very much. Oh.
Can you hear me?
Yep.
Yes, we can.
Okay, perfect. Thank you. So I do have a few questions today, and my apologies because I know it's. So I do have a few questions today, and My apologies because I know it's so do you have Okay, there we go. I'm so sorry. I was just the echo. But so I just kind of wanted to ask, one of my questions was, beyond COVID-19 hospitalizations, can you speak on how COVID-19 indirectly impacts the healthcare system in BC? You spoke a little bit on how like long COVID is going to create more, I guess, like impact in terms of needing for care. But can you talk a little bit on how COVID is going to be impacting our healthcare system in BC potentially over the next few years?
Yeah, well, I mean, I think it has to do with the potential impacts of COVID infections on the whole body. As I said, like one of the big fallacies is that COVID is a respiratory disease. It isn't. COVID is transmitted through the respiratory system, through the air, and that's how you catch it from someone. But it's a vascular disease, and the receptors for the virus, that means the little hooks on your lungs that COVID attaches to, the virus attaches to, those hooks are on every organ of your body. So it attaches to your heart, to your gut, to your brain, and it causes problems with all those organs. I can't tell you for a fact that the significantly increased rate of sudden death in young people over the last few years, like the 20 to 50 age demographic, is all due to COVID. But, you know, it's hard not to think about that significantly. People dropping dead at a far higher rate than they used to drop dead from because of the effects of COVID. Like, we know that COVID, for example, affects the function of the heart. There are studies out there that have looked at children that have had mild initial COVID infections and compared them to children who have never had COVID infections and looked at their hearts 6 months later through echocardiograms, ultrasounds of their hearts. And we know that the kids that had mild COVID infections, again, these aren't kids that were in the intensive care unit sick on ventilators and ECMO machines. They just had COVID. And their hearts are significantly worse off than the kids that didn't have COVID. All these blood clots that we're seeing out there, we know COVID is what's called a thrombogenic disease. So it incites the development of blood clots. We know that COVID affects neurons in your brain, and that's, you know, you hear people that they feel foggy and they have this brain fog business. And some people, it goes away after a month, 6 weeks. I mean, my son had COVID at the beginning of the whole Delta to Omicron transmission, and like he complained about this brain fog for weeks and weeks and weeks. But thankfully, you know, I think he got over it. Although with kids in your 20s, that, you know, remember if they got over their brain fog. But anyhow, I think in people with long COVID, that brain fog has been shown to stick around for a long time. So there are all these whole body manifestations of this virus that are going to impact the population and the healthcare system.
Okay, thank you. Very detailed answer. My next question was, you spoke on the necessity to clean the air and upgrade our ventilation. And I was wondering if you had any sense of what that would look like in a concrete terms. What would the cost for that look like? How could we start to do this concretely?
Yeah, so, I mean, clean the air is not hard. You measure air quality, and when air quality is not up to snuff, you put air filtration devices in. There's a variety of them out there. And I don't pretend to be an expert on which air filtration device goes in which place or which room, but there are people that know that information far better than I do. I do know that clean air is important. I do know that transmission of disease through water mandates clean water. Like when you have dirty water, you're going to get sick if you drink the dirty water. Like it doesn't take a rocket scientist to figure that one out. So if you have dirty air, you're going to get sick if you have viruses floating through the air. I think as far as cost goes, again, I would caution about worrying about how much putting air filtration devices in, HEPA filters in costs, because the real cost is the cost of illness. And the cost of illness trumps the cost of health any day of the week. So it just takes one or two sick people to far outweigh the costs of preventative medicine. So clean air is preventative medicine. Masks, when necessary, are preventative medicine. And just like we ask people to get annual checkups, to get cancer screening, to do all these sorts of things to help them not get sick, that's what clean air and indoor masking is all about. Prevent you from getting sick and prevent other people from getting sick in the case of personal protective.
Okay, thank you. My last question is just in something that you mentioned earlier in the seminar was that healthcare workers have been discouraged on speaking about COVID-19. I was wondering if there was any way to elaborate on that. I just wanted to know if you had any more information.
Read my Twitter feed.
Okay, yeah, we'll go there. Thank you.
You go back a few weeks, there's a thread that'll tell you everything you need to know.
Okay. Thank you so much for your time.
Thank you, Michelle Young. She's from the Peak. Thank you for your questions. I'm just taking a look to see if there's any other questions. So one other question. Dr. Gandhi, can you speak about the risks and a better approach to protecting older people?
I think protecting our seniors is really no different than protecting everybody, except for the fact that, of course, when seniors get COVID or other illnesses, that they're much more likely to have a significantly worse outcome because of pre-existing medical problems and age. I mean, age matters. I'm getting older too, and age definitely. You can't take stuff in your mid 50s like you could take stuff in your mid 20s, and when you're in your mid 70s and mid 80s, it's worse. So I just think we have to do a better job in terms of instituting all the things I've been talking about. If you're going to pick places, they need to be in long-term care facilities and schools to protect the most vulnerable of our population first. I mean, I don't see why you can't do it everywhere, but if you had to pick places first to do it, you would pick the places where people are most vulnerable.
Sounds good. People are saying that BC, following the lead of other provinces, may stop offering boosters to anyone who received the bivalent vaccine. Thoughts on this?
Well, my thoughts are that's wrong. Yeah. I mean, I don't know why. I mean, the whole messaging from public health, the whole strategy has become vaccination. And like, I'm all for vaccinations. I just think we're falling far short on the other measures that also need to be instituted. But if you're going to come out and say, get vaccinated, but we're not going to make the vaccine available anymore, I don't get it. Like, I think that what we have shown is that vaccine protection wears off after a period of time, 3 months, 4 months, 6 months, whatever it is. COVID hasn't worn off yet. So why wouldn't we continue to protect people? Unless there's financial motivation behind such a decision, because these vaccines aren't cheap. But again, healthy people cheaper than sick people. I don't understand why any province, BC included, would stop offering boosters. I mean, certain health experts have come out and said we'll probably need COVID vaccines, COVID boosters, yearly from here on in for the foreseeable future. And certainly, I mean, we get influenza vaccines every year. I don't know why protection against COVID from a vaccination perspective would be any different than from influenza. Again, it's a different disease, but protecting against it, we should use all measures possible. Vaccination clearly is not the panacea we thought it was going to be at the beginning of the pandemic, which is why we need to institute these other measures. But it's still beneficial. It still should be encouraged, and it should be readily available.
Thank you. This next question is from Akshay Kilcarney from CBC. You mentioned how racialized people will be more affected by COVID-19. How does that impact extend to workers too?
I'm not sure I understand the question exactly, but if you're talking about racialized workers, it would be the same. The racialized, minoritized community in general have worse healthcare outcomes from everything, not just COVID. And as I said, we have to institute measures to protect those particular pockets of the population. I guess that's the best way I could answer that question. If that's, I might not have interpreted correctly, but hopefully that answers it.
Okay, thank you. I think we have a few more questions on this one. So this is from Jessica Rafter. Can you define immunity? We are being told that if we have immunity after vaccines, but there's nothing stopping these continued infections with current jabs. Can you help us confuse taxpayers?
Yeah, I mean, that's a great question. Like, immunity means you're immune. Immune means you can't get it anymore, right? So vaccines don't confer absolute immunity. We know that now. And anybody that promotes them as conferring such is, again, not telling you the complete story. What we do know, and that's never been the case for the influenza vaccine either, because of the nature of variants in the influenza virus. I mean, it changes year to year to year, right? So, and COVID changes, seems like month to month to month now. So it doesn't confer absolute immunity. So when you get a vaccination, that doesn't mean you're protected from acquiring COVID. What we do know is that these vaccines mitigate against more severe disease. So you're much less likely to get severely ill if vaccinated, as opposed to not being vaccinated. And frankly, that's the case for a lot of medical interventions. We don't have a proper RSV vaccine, but we have an RSV monoclonal antibody treatment that we give to susceptible young children that does the same thing. It doesn't prevent them from getting RSV, but it makes life a whole lot better for them should they contract RSV. And I've seen the changes with that treatment over the years, because that's a relatively new thing in my lifetime anyway. So, but it's a really good question, because people are like, well, if you're still going to get COVID, why bother getting the vaccine? We also know, and I think it's important to define that there's a difference between getting COVID infection and COVID vaccines. People say, well, if I got infected, like, I'm just as immune as if I would have got the vaccine. No, that's not true. You're not. And secondly, you don't want to get the disease because of all the things we've been talking about for the last hour, right? All the potential ramifications of it. You don't want to get COVID to make you more immune. That's the last thing to do. Again, that's like getting in a car accident to prevent you from getting in more car accidents. Oh, well, I've already been in a crash, so I'm not going to get in any more. Like that the thinking just doesn't make sense.
Mm-hmm. Yeah, and I'm sure you've seen this too, where you see patients that had very mild acute COVID infections, but they end up having the worst outcomes. It's not necessarily the case. So just getting any COVID can lead to serious illness, and it's really unpredictable. So best thing is to try and prevent COVID. I think there's some other questions coming on, but last night, Dr. Peter Lynn gave a talk to my journal club, and he was talking about a universal vaccine against COVID. What are your thoughts about that?
What, you mean universal in what sense? In terms of covering all the variants?
Yes.
Well, I mean, if they can magically come up with that thing, it would be fantastic. That's what I think about that. But I haven't seen such a such a panacea on the horizon. But if there is, then I'm all for it.
That would be wonderful. I think Moderna is working on an RSV vaccine, right? They're going to clinical trials.
Yeah.
So hopefully that looks promising. Now, I think there's a few more questions coming up in a few minutes. Oh, here we go. Why has WorkSafe BC completely abdicated its responsibility for worker safety by not mandating clean air, masking, and other preventive measures?
Well, I think it's the same answer. I mean, I think it's that they get their direction from public health and the Ministry of Health, and the former two haven't been emphatic on the need for clean air, masking, and other preventative measures. It's all about, let's move on with this, we're done with it. And it's just, and people that are on this call know, like, if you're one of those people that's still talking about COVID, a lot of your friends are like, why are you still talking about COVID? It's not a thing anymore. And you have to, I don't want to say convince them, but again, educate them as to why it is a thing. It's not an obsession over this pandemic. It's an obsession over health and over the health of the population. It's really sad, actually, that we've gotten to this stage where it's become so divisive and so political, and all it's about is taking good care of people, ensuring that they have good health and a good quality of life. So WorkSafe BC should step up to the plate, but unfortunately they're being given direction from those that haven't.
Great answer. And I think there'll be another question coming up. Here we go. Since PHAC, Safe BC, BC CDC acknowledged that surgical masks are not PPE, why aren't healthcare workers allowed to use N95 masks?
Well, that's another great question, and I actually didn't know that that was the case. When I was at BC Children's Hospital, I could wear an N95 if I wanted to. So if that's the case, I mean, if there are certain institutions where healthcare workers aren't allowed to use N95s, to me, that's just utterly ridiculous. Like,
It's in long-term care right now.
They're not allowed to use N95s?
No, they're not allowed to.
I mean, I'm speechless on that one. I don't know why anybody would be prevented from using the personal protection that they feel safest with and they think is most effective and that is most effective. I mean, truth be told, I think it depends on where you are, and in that part of it, you do have to assess the situation. I mean, there are certain places where I will wear an N95. There are certain places where a surgical mask I think is appropriate, but it's because of I know what the air quality is like in those places. I mean, that all comes into account, but I don't think anybody should ever be prevented from protecting themselves more if they think that's necessary.
Yeah, in Ontario, you're allowed to purchase your own N95 masks for long-term care workers, but not in BC. You're not even allowed to purchase your own.
That's craziness, though. Like, what? I don't get that at all. That would be like, I don't know. That'd be like saying, kid that's going skateboard that wants to wear a helmet and shin guards and knee pads. Well, you can't wear the knee pads because you're not allowed to. Like, I don't know. That's mind-boggling to me.
Yeah,
I don't have a reasonable answer for that.
Me neither. Oh, there's also a comment that some patients are still being asked to replace their N95 masks or surgical masks when they come to hospital. And I've seen that as well, where the patient's asked to take that off and put on one of the blue surgical masks, even though if it's a brand new N95 mask.
Well, I think if people are asked to do that, they should push back as hard as they can possibly push back. And if it's at an actual hospital, I think they should take those observations, those complaints to administration of that hospital and make them prove that the mechanisms they've put in place, that here replace your brand new N95 with a simple blue surgical mask, where the data is to show that that is a reasonable approach. So I would just encourage the courage to be able to push back against the so-called leaders and administration of these places. Again, there was a question earlier about muzzling healthcare workers and administration and all the rest of it. And administration is one of the biggest problems in healthcare in British Columbia. We have way too many of them. It's way too top heavy. The bureaucracy is way too thick. And the more people out there, the more people on this call, the more people that see this webinar, whatever, that can wade through those layers, the more we can thin them out. Like, I knew if I was Minister of Health, I know what I would do with all those layers, but I'm not. And so we have to fight it. In the meantime, we have to fight it layer by layer, I guess.
So we have time for one more question. So this question asks about, what do you think about Novavax?
Well, I mean, I think I'm not an expert to tell you the specifics of the mRNA vaccines versus Novavax. There is a fair bit of data about the benefits of Novavax. But I think the message about getting vaccinated should be maintained. I know people that have gotten mRNA vaccines plus Novavax, and I really don't think that different forms of vaccinations are harmful in any way, shape, or form. Like, the more the better. But I don't want to answer the scientific basis of the question. I acknowledge what I do know. I also acknowledge what I'm not an expert on. So I don't think I'm an expert to answer that question.
Thank you very much. Well, thank you very much, Dr. Gandhi. I think I'm going to wrap up the question and answer period. But thank you for taking all this time to come do the interview with us and for answering so many questions.
Well, I mean, I appreciate the opportunity and the work of the folks at Protect Our Province BC. It's hard work to do. It's only getting harder because of the pushback. And I applaud you for doing it. Applaud you for trying to keep the people of BC safe and protected. And I think, although it might be about COVID today, it certainly could be about something else tomorrow or something else the next day. So it's an advocacy group which is much appreciated by many, and I appreciate the opportunity you've given me to share what little I know.
Thank you so much. So we're going to wrap up. And so in conclusion, we are at one of the most dangerous times of the pandemic, with almost all protective measures against COVID removed by our government, COVID being minimized, and the public being led to believe the pandemic is over. This is why we are still seeing so many children and adults sick with COVID, and why our hospitals are still at overcapacity in BC. But Dr. Gandhi, we thank you very much for your courage in speaking out and telling the public about the true situation in BC with this pandemic. It's been so important and inspirational to us all. And so many thanks again to Dr. Gandhi. And we also would like to thank all the listeners who listened in on our briefing today. Our next Protect Our Province BC conversation will be on Paxlovid, and we will be announcing the date and time on Twitter and Facebook. So thank you all again, and thank you, Dr. Gandhi.